Welcome to Royal Columbian Hospital. We look forward to providing you and your family with exceptional care at this important time of your life. The purpose of your tour today is to familiarize yourself with the hospital and the maternity unit. My name's Estella, I'm an RCH volunteer,
My name is Haley, and I'm a labor and delivery nurse.
and we will be your guides today during this tour.
If you have specific questions regarding your pregnancy or upcoming delivery, we recommend asking your pregnancy doctor or midwife. If your concern is urgent, call the triage nurse on the obstetrical unit at 604-520-4586. This number is answered 24 hours a day. Sometimes your question can be answered on the phone, but sometimes the nurse will advise you to come to the hospital for assessment. Even if you know you need to come in, call the triage number first. This allows the unit to plan and prepare for your safe care.
You have several parking options at RCH. Underground parkades. Under the Healthcare Center and under the Mental Health and Substance Use Wellness Center, availability is limited as it is shared with healthcare workers. There is no in and out privileges. With COVID, some pay stations are not charging for parking right now. Check the meter for signage. Metered street parking is the most economical. There's no charge after 8 p.m. until 8 a.m. Please note that due to construction for the new hospital, the emergency lot and Sherbrooke Surfaces lot will not be available for parking. There will be a patient drop-off lane available at the emergency entrance. Tickets can be purchased at the parking meters for hourly and daily rates. Up-to-date ticket pricing is available on the parking meters and the Fraser Health website and vary by lot.
Our tour today starts in the main lobby of the hospital. The main entrance doors off Sherbrooke are closed for construction, and you are asked to use the emergency department entrance to get to the green zone. Due to COVID, there will be volunteer greeters at the entrance that will ask you about any potential symptoms of COVID-19 and ask that you sanitize your hands. You will need to do this every time you pass the entrance. Thank you for your cooperation in keeping us safe. Please note that support people with symptoms should not enter the hospital. Patients with symptoms will be able to enter, but please wear a mask and let your healthcare providers know about your symptoms so they can direct you to the appropriate care areas.
All women coming to RCH for assessment, non-stress tests, or admission are requested to stop at the patient registration desk on the first floor. It is located by the lobby and gift shop. You will need your care card for registration. The clerk will print off your assessment papers and either send them to the unit or give them to you to bring to the triage nurse. This desk is only open from 6 a.m. to 3:45 p.m., Monday to Friday, excluding holidays. After hours and weekends, you will need to go to the admission area in the emergency room to register. If you feel you cannot wait to register, you may proceed directly to labor and delivery and then have the person accompanying you, your partner or support person, returning to registration with your care card.
Use the green zone elevators to access the labor and delivery and NICU units on the second floor and the postpartum and antenatal units on the third floor. Do not use the blue zone, the Columbia Tower elevators, as these do not connect to the maternity wards. Before we go upstairs to labor and delivery on the second floor, please note that the outpatient lab is located just behind the elevators. Most lab work during pregnancy will be done off-site, but sometimes your provider will ask you to come to the hospital lab for specific lab tests. If your blood type is Rh negative, you will need to get a RhoGAM or Winrow shot. Your doctor will give you the prescription and directions to pick this up. Bring this prescription to the hospital laboratory on the main floor, the window near the blood bank. Take your RhoGAM to your next doctor's appointment. Once you take the elevator to the second floor, you will exit and turn left towards the labor and delivery unit. Our unit is a locked unit, and you need to use the gray doorbell and intercom to request access. Please approach the main nursing desk immediately in front of you. The triage nurse will then bring you to the assessment area.
Firstly, no one should visit if they are sick. All visitors should use the alcohol hand wash when entering the hospital, and again before entering the unit. Alcohol hand wash dispensers are available along the walls throughout the hospital. Anyone holding baby also needs to thoroughly wash their hands. For reasons of privacy and safety, visitors are not to stand outside the patient's room in the hallway during birth. There is a waiting room outside the labor and delivery doors, outside the postpartum ward, and in the main lobby. Visiting hours are flexible. Unfortunately, we are unable to accommodate children or other family members overnight on the maternity unit. Wi-Fi is available in most areas of the hospital. Visitors should use the bathroom located outside the unit, as in-room bathrooms are for patient use only. Due to COVID, only one designated support person is allowed to accompany you during the pandemic. This person must be healthy. If they have any symptoms, they should not enter the hospital. We recommend being ready to have an alternate support person with you. Note that public health considers all these symptoms potentially COVID. If you or your support person has these symptoms near your due date, we recommend getting a COVID-19 test right away so that your healthcare team can make a decision about your care and the safety of having your support person there with you.
The assessment area is where your provider will check your vital signs, listen to the fetal heart rate, perform any necessary initial exams, and make a decision about where you will go next. For patients with symptoms or known COVID, we have special designated areas where we can safely perform the triage assessment, admit to labor, and recover postpartum. At RCH, the delivery rooms are separate from postpartum rooms. This means that you will labor and deliver on the second floor, then be transferred to the third floor once you are ready to go to the postpartum unit. Labor rooms are all private. Once admitted, a maternity nurse will be assigned to you to support you and your family throughout your labor and delivery. Each room has its own bathroom, including a shower and/or tub. Visitors are asked to use the visitor's bathroom outside the unit. Each room has its own temperature control that the mother can adjust to meet her comfort needs. Some of the equipment you might encounter in this room include the following: a labor bed, birthing balls, including the peanut ball. We have a selection of sizes and types of birthing balls. During COVID, we ask that you please do not bring your own from home. Birthing bar, birthing stool, a tocometer, which is a contraction monitor, the fetal heart rate monitor and Doptone, IV pump, epidural pump, nitrous oxide, which is available even during COVID, a baby resuscitation bay, a partner chair and bed. The fridge and ice machine are available for patient use. The freezer contains frozen maxi pads for postpartum use. Cesarean sections are done in the main operating room next door to labor and delivery through these double doors.
Most babies stay with their moms immediately after birth. After C-sections, most of the time, mom, baby, and support person recover together in the post-anesthesia care unit for about an hour or so, although there are circumstances when this is not possible. For example, there are other times when your baby may require special assistance in the nursery, NICU, or other times when baby proceeds to the postpartum ward with a family member while mom receives special PACU care. Should your baby require in the nursery, we encourage you to spend as much time with him or her as possible. Sometimes your doctor will have you come for non-stress tests or NSTs during your pregnancy. Your doctor's office will arrange for this referral, and the NST nurse will contact you to book your appointment. On the day of your appointment, you stop at the admissions desk to register and then proceed to the elevators. The NSTs are done on the third floor NST clinic. Sometimes NSTs are done on the second floor labor and delivery triage area. Your nurse will tell you if this is the case. Other clinics on the third floor include the Gestational Diabetes Clinic and the Maternal Fetal Medicine Clinic, where you might attend if you need a biophysical profile (BPP) performed.
Postpartum rooms are private, semi-private, or ward, and are assigned based on patient preference and availability. In a semi-private room, there are 2 families rooming together, and a ward room has 4 patients. The ward rooms are usually used for patients needing admission for care early in their pregnancy, or rarely postpartum if the unit is at maximum capacity. Please make your room request after delivery. Rooms are assigned based on availability, medical need, and birth times, and cannot be reserved in advance. If you have extended health benefits, your payment and forms will be processed when you leave the hospital. You can check the RCH website for the latest fees. All visitors are asked to use the visitor bathrooms just outside the unit doors. In-room bathrooms are for patient use only. Things you may need to find in the kitchen located by the nursing station are the ice and water machine, microwave, toaster, instant coffee, and tea bags. Due to COVID, the kitchen is not currently open for patients or support people. Please call a nurse if you require water, snacks, or other items. Ice packs and frozen padsicles are located in the freezer of the patient fridge. Support people are encouraged to help bring these to mom. There are basic items available for mom in the fridge as well. Please note that this is for patients' use and not for family members. Please use the in-room mini fridge only for any personal food items, as personal items are not allowed in the communal fridge. A maternity nurse will be available to assist and teach you with caring for your baby. Lactation consultants are available for additional assistance, but require a referral from your provider. Most babies are in the room with their moms 24 hours a day, unless they are receiving special care in the NICU. All meals are provided for patients in typical hospital fashion. Please notify your nurse if you have any allergies or specific dietary concerns. Please refer to the booklet, Having Your Baby, Your Hospital Stay, for more information. If you have not received a copy yet, please register with the Public Health's Best Beginnings program online, and one will be mailed to you. Standard newborn care includes scanning for bilirubin levels, hearing screening, screening for congenital heart disease, a heel prick test for genetic disease, antibiotic eye ointment, and a vitamin K injection to prevent serious bleeding. Some of these are done in the labor room, and others will be done postpartum. Speak to your provider if you have any questions about these procedures. Newborn security is of the utmost importance to us. All staff should have photo ID. Routine newborn procedures can usually be carried out in your room, or you may accompany your child. The unit is designed with your family's security and safety in mind. We offer the following features during your stay: cameras that monitor the entrances and exits, a locked entrance, matching name bands, 2 for the baby, 1 for mom, and 1 for the support person, rooming in with your baby. Babies should remain on the maternity ward until discharged. Never leave your baby unattended. For your baby's safety, we ask that they are not carried in your arms while walking in the hall. Please place them in the bassinet that will be provided for you.
RCH recommends that all valuables be left at home. Do not leave wallets, purses, cameras, laptops, and other electronics in full view. Please note that the hospital is not responsible for lost or stolen items. Lockers are available on the postpartum ward. Bring your own lock. We encourage you to have one support person with you during your stay. This person is encouraged to stay with you during your labor and to participate in supporting you and your baby's care. Each of your rooms is equipped with a couch, mattress, and convertible recliner for your person to sleep on. We do request that they bring their own pillow and bedding. Due to COVID, please keep bedding to a minimum and bring it in a plastic bag. Your support person will also need to bring their own food. Food can be kept in the in-room patient mini fridge or may be ordered in. There are several food establishments nearby if they wish to leave and pick something up. The cafeteria in Tim Hortons is in the basement and is open during the day. With COVID, different hours may apply.
The decision of when to go home is made between you, your physician or midwife, and your nurse. Healthy mothers and babies are usually discharged 24 hours following a vaginal birth or 48 hours following a cesarean section. Care for you and your baby is discussed with you prior to leaving the hospital. Before you leave, please ensure that we have the correct address or phone number, or an alternate address and phone number for where you will be staying. This information will be shared with the Public Health Office so the community nurse can get in touch with you.
The Postpartum Education Room runs a 60-minute discharge preparation video daily in the mornings. Listen for the overhead announcement. Due to COVID, the group viewings are suspended, so we recommend that you watch the discharge preparation videos on your own device from your room. You may review the video ahead of time if you would like, with the link below. Please make sure you are very familiar with your car seat well before labor. Your nurse will review your car seat safety with you before you go home.
This concludes our Royal Columbian Hospital Wayfinding Maternity Tour.
We encourage you to talk to your pregnancy care provider as well for any specific questions you might have.